Welcome to this webinar. My name is Stephanie, and today's topic is about applying principles and aims of a palliative approach when supporting people. This unit describes the performance outcomes, skills and knowledge required to provide care for people with life-limiting illness and those within the normal aging process within a palliative approach, as well as end-of-life care. This unit applies to workers in a residential or community context. Work performed requires some discretion and judgment and is carried out under regular direct, indirect, or remote supervision. The skills in this unit must be applied in accordance with the Commonwealth and State Territory legislation, Australian standards, and industry codes of practice. At the end of this session, you will be able to apply principles and aims of a palliative approach when supporting people. Palliative Care Australia 2018 defines palliative care as a person and family-centred care provided for a person with an active, progressive, advanced disease who has little or no prospect of cure and who is expected to die, and for whom the primary treatment goal is to optimise the quality of life. Palliative care can be given in most healthcare settings. For this unit, the healthcare settings include residential and home and community care. The palliative approach specifically refers to the way that care is delivered. For care to adhere to the palliative approach, it must follow certain philosophies and principles and have specific aims. Some of these are to improve the client's quality of life by relieving them of their symptoms, provide the client relief through medication, care, and support while considering their needs, values, and preferences, provide support to the carer, family, and relevant others affected by the diagnosis. Throughout this unit, you will use the terms related to palliative care. Client, the person or resident receiving care. Carer, an individual who provides unpaid informal support and care to a family, member, friend, or neighbour who needs assistance because of disability, terminal illness, chronic illness, and/or mental illness. Family, these are the people closest to the individual and with whom the individual has an ongoing personal relationship. The treating care team, this is a group of people involved in the client's care. The team may include doctors, nurses, Aboriginal health workers, and allied health professionals. Apply principles and aims of a palliative approach. A life-limiting illness is an illness or disease that cannot be cured and is expected to shorten one's life. It can be malignant or non-malignant. Often these lead to further health complications, causing physical pain and psychological distress. Some examples of illnesses that may require palliative care include cancer, dementia, stroke, chronic obstructive pulmonary disease, congestive heart failure, Alzheimer's disease, and kidney failure. These illnesses are irreversible and the chance of long-term recovery is low. The palliative approach. As a support worker, you are responsible for providing care and support to clients with life-limiting illnesses and relevant others. Knowing the philosophies, principles, and aims of a palliative approach will help you do this task. Philosophy is a stance that serves as a good guide for one's conduct. In the palliative approach, underlying philosophies guide people who provide palliative care, such as care must address the needs, preferences, and values of the client and relevant others. Care must be person and family-centred. Care must be accessible to people with a life-limiting illness. Care affirms life but recognises death as an inevitable part of it. Principles are behaviours and attitudes informed by underlying philosophies. In essence, a principle is a philosophy translated into thoughts and actions. The principles of palliative approach include, but are not limited to, recognising and addressing the needs, preferences, and values of the client, providing holistic care to address the needs, preferences, and values of the client, recognising the integral role of the relevant people around the client in planning and decision-making, treating clients and relevant people around them with dignity and respect, respecting the cultural, spiritual, and religious needs of the client, supporting the decisions of the client and relevant people during the provision of care, supporting the bereaved people following the death of the client. Aim refers to the purpose or the desired outcome. The palliative approach aims to improve the quality of life of the person with a life-limiting illness, provides support to the relevant people around the person with a life-limiting illness. The National Palliative Care Standards. The National Palliative Care Standards are a set of standards for providing palliative care. Palliative Care Australia created these standards. The organisation is the peak national body for palliative care. The standards list care providers' requirements when delivering palliative care. For this unit, these standards are applied in community and residential care. So standards 1 to 6 are care standards necessary for delivering quality care. Standard 1, the assessment of needs. The assessment focuses on the client's physical, psychological, cultural, social, and spiritual needs and relevant others. The client's needs are assessed regularly. Assessment results from the care plan and any changes are noted. Standard 2, developing the care plan. The care plan addresses the client's physical, psychological, cultural, social, and spiritual needs and relevant others. Client and relevant others are involved in the planning and updated regularly. The care plan is updated regularly. Standard 3, caring for carers. Carers' needs are assessed and documented. Carers are involved in planning and provided with information and resources. Carers are educated on care before and after death. Standard 4, providing care. Care is delivered promptly. Care addresses the changing needs of the client and relevant others. Care addresses the physical, psychological, cultural, social, and spiritual needs of the client and relevant others. Care that does not fit the goals and preferences of the client is negotiated. Standard 5, transitions within and between services. Prepare for transition between care settings. Referrals to specialists or services are done to address the client's physical, psychological, cultural, social, and spiritual needs and relevant others. Further support is given for care at home, depending on the client's preferences. Standard 6 is grief support. Family and others are given culturally appropriate information and resources. Support services are regularly provided to family and others before and after death. Referrals to support groups or professionals, such as counsellors or psychologists, are made as needed. Staff are given education and support about grief, bereavement, and loss. Standards 7 to 9 are government standards for quality management and improvement of service providers. Standard 7, service culture. The service provider provides person-centred palliative care. Care supports the needs and preferences of the client reaching the end of life, their family, and others. Standard 8, quality improvement. Service providers comply with governance and safety requirements. Quality service is ensured by improving existing systems, participating in research, and engaging in clinical audit reviews. Standard 9, staff qualifications and training. A multidisciplinary team is available to meet the clients' and other people's various needs. Staff receive support and supervision. Staff undergoing training to ensure the delivery of culturally safe care. Staff are trained in self-care strategies. Identify the holistic needs of the person. Holistic means that care recognises and addresses the entirety of the person. Holistic needs include physical needs, such as managing pain and other symptoms, providing comfort. Emotional needs, providing comfort. Psychological needs, talking to the client about needs and worries. Social needs, connecting the client to others. Spiritual needs, providing care in line with the client's beliefs. The palliative approach as a person-centred approach. Person-centred means putting a person at the centre of their care. The person-centred concept aims to protect the rights and dignity of a person. It focuses on matching services to meet a person's needs and wishes. In providing person-centred palliative care, you should give the person control over their care, focus on the person's strengths, involve the person's family and relevant others. Tailor your care to the person's circumstances. The palliative approach as a holistic approach. Palliative care should not be limited to addressing only the person's physical or medical needs. Care must also address the person's psychological, emotional, social, cultural, and religious needs. The scope of palliative care must cover the needs of the client, starting from the diagnosis of their illness up until the end of life. The needs of the relevant people, example family, during palliative care and after the client's death. The benefits of the palliative approach include the provision of care services that cover the scope previously mentioned. Services holistically address the needs of everyone involved. These services are also served to address the person's holistic needs extending over time, not just during end of life. Palliative care services include treatment of symptoms, individualised goals for care, additional support, coordinated care, care after death, and emotional support for the bereaved. Holistic approach to address end-of-life needs. End of life refers to the period where the person suffers from an irreversible decline due to their illness. This period may last for years if the person has a chronic or malignant disease. This period may be brief for those who suffer from acute or unexpected illnesses. End-of-life needs may vary from client to client. However, the same services are offered to them, though tailored to their requirements. Most incurable diseases cause a lot of pain to the client. Treatments of symptoms helps ease pain and improve quality of life. Understanding what causes pain helps determine the treatment to be given to the client. Individualised goals for care. Palliative care is tailored according to the person's preferences, wishes, values, and beliefs. To understand what the client wants regarding their treatment, proper communication between the client and the care team is needed. For instance, nutrition and hydration are vital in palliative care's early stages. Some of the client's hydration requirements may include provision of artificial hydration if the person has difficulties swallowing, consumption of foods such as fruits and vegetables with a high water content, tracking water intake and urine output to ensure the person is not dehydrated. During end of life, the focus of nutrition is to provide comfort and better quality of life on the last days of the client's life. Easing hunger and thirst is important, but not at the cost of the client's comfort. The other needs of the client's families and carers are also assessed. This ensures that care provided follows their wishes, values, and preferences. Support is also given for any psychological and emotional impacts experienced by the client and relevant others during palliative care. Additional support. Refer to the table below for the possible psychological and emotional impacts. So for the client, psychological impact could be depression, anxiety, or fear. Emotional impact, anger, denial, or shock. For the family, psychological impact could be depression, anxiety, and fear. Emotional impact could be guilt, helplessness, and shock. For the carer, the psychological impact could be just depression and anxiety. Emotional impact could be helplessness and sadness. Others, example, the client's friends or colleagues, their psychological impact could be depression, anxiety, and fear, and possible emotional impact could be shock, denial, and sadness. Coordinated care. Palliative care services help organise the delivery of care. The care team can bring in specialists or try different diagnostic and treatment interventions. Care may also be delivered in multiple settings, example, home care, nursing homes, hospice care, as per the client's wish. The trouble and stress of undergoing different processes within different healthcare setups in palliative care is minimised. Holistic approach to address needs extending over time. Addressing the client's holistic needs is not limited to just end of life. Holistic needs do not end when the life of the client has ended. These needs extend after death and revolve around the loved ones that remain. Care services addressing needs extending over time include care after death and support for the bereaved. Support the person and the relevant others to express needs and preferences. It's important to demonstrate support for the person's needs and preferences. This encourages the person to be more comfortable with you and other care team members. Seeing your support encourages the person to be open with the things they expect in a palliative care service. It also allows care team members to accurately identify these needs and preferences. The person, family, carer, and relevant others feels valued when supported. This improves the relationship between them and the care team. Effective communication. So elements of effective communication include building rapport, active listening, showing empathy, verbal communication, and non-verbal communication. The first and most important step to opening communication lines is building rapport. Rapport is defined as a harmonious relationship between individuals or groups of people. You can build rapport in simple but effective ways by using the following techniques. Addressing people using their names. Addressing people by their name implies attentiveness and interest. You might be surprised to learn how many people appreciate being remembered. In your line of work, it is especially more meaningful. Mirroring the speech and expression of the person you are talking to. Mirroring is copying the speech, expression, or mannerisms of the person you are talking to. You must match your speech or expression to your conversation partner. Paying attention to these little things shows that you are attuned to others. Using non-verbal language. Body language is equally as important in communication. Your words will not appear sincere when your body language does not reflect them. Some common examples of body language include eye contact, facial expressions, posture, gestures, and giving space. Aim to match your body language to your clients. However, you also must be mindful when mirroring body image. Do not mirror those that may seem to be rude or showing disinterest. Be mindful of differences in cultural upbringing or personal attitudes. Active listening is listening to both what is said and is not being said. It is also listening without judgment. Aim to match your body language to your clients. When listening to the other person, dedicate your full attention to them. Show that you understand their point by paraphrasing or repeating what they said in your own words. Match the tone of voice and expression and take note of and respond to any changes. Ask follow-up questions to show you care and want to know more about their experience. Most importantly, listen without judgment. Hold your biases at bay and practice empathy. Empathy is understanding and feeling others' emotions. Imagine yourself in their situation and aim to validate their feelings. Making a connection by finding shared interests. Talking about your shared interests will help you connect with others. Ask the client about their hobbies and favourite shows or food. Being genuine in your interactions. Your genuineness will be recognisable by everyone you encounter. When you're authentic in approaching others, you will find that they will be the same. Below are other communication strategies you can use with your colleagues. So person, showing transparency by promptly informing the person of any updates regarding any changes to their care plan. Carer, promptly informing the person's carer of any updates in the person's care plan. Family, asking feedback from the family regarding your ideas on the case strategies for the person. Others identified by the person, remembering the names of the person's friends and address them by their names. Reporting information to your supervisor. Information refers to the clients and their relevant others, needs and preferences that you previously identified. After identifying this information, you must report this to your supervisor. Reporting information to your supervisor ensures that everyone in the care team is updated about the client and relevant others' needs and preferences, that the care provided will remain in line with the client's and relevant others' needs and preferences. Some of the information you have to report may include needs and requirements of clients that are not within the support worker's job role. Example, providing psychological counselling, diagnosing medical conditions, and prescribing medications, etc. Clients' needs and preferences regarding their care. Clients' changing needs, example, clients increasing pain, requiring a higher dosage of pain medication. Communicate with the person and their relevant others about quality of life, pain, and comfort. Quality of life refers to how a person perceives they are healthy, comfortable, and able to enjoy their life given their health status. Pain and comfort levels are factors that greatly affect the quality of life. Pain is a distressing sensation in the body that physically and mentally hurts a person and causes discomfort. Comfort is the absence of pain or distress. When a person is comfortable, they can do the things that they need to do. Their pain levels must be reduced and their comfort levels promoted. To know about the client's pain and comfort levels, you must communicate with them and their relevant others about these. Communication can include always asking about the client's pain and comfort levels during your interactions with the client and relevant others, asking follow-up questions when a client hesitates to talk about their pain and comfort levels, asking follow-up questions when a client shows signs of being in pain, cultivating an open dialogue with the client by letting them know that managing pain, promoting their comfort, and improving their quality of life are of the utmost priority. Barriers to reporting pain and comfort levels. Barriers are things that block communication. Communication barriers hinder truthful reporting of pain and comfort levels. The barriers to reporting pain are often personal. Older clients are less likely to truthfully and accurately report their pain because they believe their pain is part of the aging process. They do not want to be a burden. They do not have the right words to describe the pain they are feeling. They come from a culture or generation that believes pain must be endured. They fear that strong medications may have adverse side effects. They think that increasing pain is a sign of a worsening condition. Adjust communication techniques to meet the individual needs of the person and their relevant others. In palliative care, you are working closely with different people. Each of them is unique with different personalities and attitudes. Because each person is different, you must adjust communication techniques depending on who you talk to. Adjustments are changes made to improve something. Adjustments to communication techniques ensure that communication remains effective regardless of the context and the person taking part. Misunderstandings are minimized. Both parties understand each other. The client, their carer, family, and relevant others can better express their needs such that these needs are supported and met. The effectiveness of these communications would also depend on how you adjust them to suit your purpose. So consider making adjustments according to the following factors. Context refers to the circumstances, example setting, time, topic surrounding the conversation. Adjusting communication techniques based on context ensure that communication fits the current circumstances. Talk in a private and comfortable space. Set the context of the conversation. Communicate with the concerned person at the appropriate time. Delivery refers to the way the words in a conversation are given. Adjusting delivery of communication techniques ensure the message conveyed is clearly understood. Use words that are easy to understand. Avoid medical jargon. Say what needs to be said, but with kindness and understanding. Being honest helps lessen misunderstandings. As much as possible, avoid using euphemisms during conversations. Example, passing away instead of dying. Open conversations allow for better preparation in palliative care. Use non-verbal language to reinforce your message. Audience. The audience is the person you are talking to. Adjusting communication techniques according to your audience ensures communication remains relevant. Consider the audience's communication needs. Consider the audience's personal circumstances in your communication. It is necessary that you adapt to these so that communication remains effective. Learn more about your audience and how they communicate. Respect and support the person's relevant others as integral parts of the care team. Throughout palliative care, the carer, family, and relevant others remain an integral part of the care team. They can serve as a bridge between the care team and the client to communicate needs. Respect is often seen as related to a person's rights, decisions, and feelings. Respecting someone as an integral part of the care team means they are involved every step of the way. The family, carer, or relevant others may have to be consulted on some matters. They may also have to make decisions later on behalf of the client. They may also identify gaps or errors in the care delivery, which can be important in improving the client's quality of life. You can demonstrate respect to the client's family, carer, and relevant others through the following actions. Get to know the client's family, carers, and relevant others. Take the time to talk to the important people in the client's life. These people can provide insights about your client, such as their personality and behaviour. They can also tell you information that you can use to form a stronger bond with your client. Be sensitive in your words, using language that does not imply discrimination. Listen to the concerns of the people that may be influenced by their cultural, traditional, or religious beliefs. Be patient in explaining the purposes of treatments involved in palliative care and provide assurance that the client is safe under your care. Share information. Keep the client's family, carers, and relevant others updated with the client's condition. You can also share to them the anecdotes of the client's behaviour. In turn, they can suggest tips on how you can communicate better with the client. Ensuring that family and relevant others are informed and supported. Ensure that the family and relevant others are continuously informed and supported. To be informed means having access to the client's care information. Keeping them informed encourages them to be involved in the client's care. Shared information related to the client's care includes the illness prognosis, progress of the client's condition, effectiveness and possible side effects of pain medications, context of the client's individualised care and advanced care directives, name of the care staff members caring for the client, changes that might have taken place while they were away, changing needs and preferences of the client. To ensure the family and relevant others are informed, you must discuss how to share best the information needed by the family and relevant others with your supervisor. Ask the family and relevant others if they have questions or clarifications about the information shared with them. Encourage the family and relevant others to approach you or anyone from the care team which they have questions about the client's care. On the other hand, to be supported means that the family and relevant others are given the support that addresses their needs and preferences. Different kinds of support can be given in various ways by different professionals. To ensure the family and relevant others are supported, you must encourage the family and relevant others to share their needs and preferences with you or anyone from the care team. Continuously engage with the family and relevant others to know if there are any changes to their needs and preferences. Discuss with your supervisor how to best support the identified needs and preferences of the family and relevant others. Provide support to the family and relevant others as stated in your job role. What have we learned? In this session, we have learned about how to apply principles and aims of a palliative approach when supporting people. In the next session, we will learn about respecting the person's preferences for quality of life choices. From here, you need to go to your tutor's online learning portal and complete the assessment activities. Thank you for your time today, and I hope you found the session informative. Welcome to this webinar. My name is Stephanie, and today's topic is about requesting the person's preferences for quality of life choices. Quality of life choices refers to decisions made by your client related to their quality of life. These decisions may involve the type of care they receive or where they will receive it. Respecting the client's preferences for quality of life ensures that the client remains at the centre of palliative care. Create a supportive environment to share information regarding their changing needs and preferences. Life-limiting illnesses are often chronic and progressive. These are irreversible, and further health complications are expected in the long run. There will be changes in the client's care depending on the stage of their illness. You must identify these changing needs and preferences so that the care team can address them appropriately. Some of the client's changing needs in palliative care may include changing levels of care to address the physical symptoms of the illness, psychological needs associated with the effects of the illness, example, depression, emotional needs associated with the effects of the illness, such as the illness prognosis, spiritual needs, such as finding solace in one's faith, changing levels of assistance with tasks as the illness progresses, example with feeding, where they want to receive care, what foods they would like to eat, and which services they would like to receive. A supportive environment encourages everyone to freely express their needs and preferences. Knowing these needs and preferences will be easy for you and your care team to respond to them. There may be barriers that prevent your client and others from being open, example, cultural differences and personal attitudes. However, using the appropriate communication strategies will help you overcome them. Below is a quick refresher on the elements of good communication. So building rapport, active listening, showing empathy, verbal communication, and non-verbal communication. Below are other communication strategies you can use to demonstrate support. So for the person, politely asking the person whether they need assistance with a task or not. Carer, setting one-to-one meetings to share services and resources for self-care. Family, regularly checking in with them to see how they are doing through consultations, quick messages, or simple phone calls. Others identified by the person, showing consideration of any suggestions or feedback they share by actively listening to them and noting all of these down. Another way to demonstrate support is by empowering the people in your care. Below are communication strategies you can use to empower them. So the person, using positive words such as "you can do it" to encourage the person to accomplish things they find challenging. Carer, acknowledging the challenges shared by the carer and using positive words to motivate them. Family, showing positivity through positive body language, example, appropriate eye contact, firm posture, etc., to ensure the family that everything is well taken care of. Others identified by the person, using positive words to thank them and motivate them to continue putting efforts to supportive person. I appreciate all the things you do to help your friend under our care. Trust is a prerequisite to creating a safe and supportive environment. With your relationship established, it is just a matter of doing what you can do to nurture this environment. Continue practicing the communication techniques you previously learned to give support. Respect the person's individuality, values, and beliefs. Individuality is the total sum of traits and characteristics that makes a person unique. A person's individuality is influenced by their values and beliefs they hold. Values refer to what a person sees as essential to their life. Values often guide a person's behavior. Beliefs refer to what a person accepts as true. Beliefs involve things that may or may not exist, or things that may or not be based on facts. Respect refers to the consideration that is shown towards other people's individuality, values, and beliefs. Consideration is also given towards their feelings, rights, and wishes. Respecting our client's individuality, values, and beliefs provides person-centered palliative care. It also benefits, such as it improves the client's quality of life, it improves the relationship between the client and the support staff caring for them, and ensures that the client is given care that does not discriminate based on personal differences. It distracts clients from their medical problems or condition. It reduces the risk of a client depression and other emotional problems. To show respect towards a client's individuality, you must do the following. Acknowledge the client's uniqueness. To acknowledge someone's means to accept the person for who they are. You can show acknowledgement of the client's uniqueness by showing the client your interest to know more about them, allowing the client to express themselves without judgment, and avoiding comparison with others. To show respect towards the client's individuality, you must respond in a way that is acceptable and meaningful to them. In every interaction, you must approach the client acceptably. To be acceptable means being mindful of how you present yourself to them. When you approach the client in acceptable ways, your interactions with them are more meaningful. This would make the client feel that they are more than just a patient. Provide support that fits the care. Support provider must fit the client's needs and preferences. A one-size-fits-all approach will not work, as each of your clients will have unique characteristics and therefore unique needs. Ways you can show respect towards your client's values and beliefs. Keep an open mind and understand your client's values and beliefs. Replace value judgments with curiosity. Seek to understand what makes a client consider certain matters important or true. Ask questions to know more about the client. Genuine curiosity will encourage them to share more about themselves. Listen to what the client has to say. Listen attentively with the intent to understand, not to contradict. When the client is aware that you are hearing the words and the content of what they are saying, they will feel respected. Listening will also help you understand more about the values and beliefs important to your client. Listening will help you understand the life they live and the choices they make, including those related to their care. Example, end-of-life decisions. Identify and address your prejudices. Differences in values and beliefs may affect the way you interact with others. These biases may be unconscious and may be reflected in your care services. Actions influenced by unconscious biases are often harmful, hurtful, and disrespectful to the other person. You must examine any biases you may have. To do this, ask yourself, how do I feel about people with values and beliefs different from mine? Do I consider values and beliefs different from mine as valid? Do I feel uncomfortable with any of my clients' values or beliefs? Are my values and beliefs affecting the way I provide support to my client? What do I feel when I judge others with values and beliefs different from mine? What would I feel if I'm judged according to my values and beliefs? Identify needs and issues outside the scope of your job role. It is important to understand exactly what you should do so that you can perform your job role properly. If you do not know the limitations of your role, you may overstep your boundaries. Making sure to read and understand the details of the role when you are applying for a job in aged care. There are different roles in palliative care in aged care work, and each role comes with different tasks. The scope of the job role is the limitation of your role based on your position and training. This refers to the scope of your responsibilities to the palliative care sector. Going beyond your scope of practice can lead to negative consequences. You may accidentally cause harm if you do something outside of your work role or training. Confirming work role responsibilities. You must confirm your work role with your supervisor. Confirming ensures that both of you agree on your responsibilities. You can also ask your supervisor any questions and clarifications that you might have. The process of understanding and confirming your job role is reading your job description, understanding your responsibilities, discussing your responsibilities with your supervisor, referring needs and issues outside of your job role to your supervisor. Needs and issues that fall outside the scope of your practice must be referred to your supervisor. Referring ensures that you do not accidentally cause harm to your clients. Referring also ensures that the client's needs and issues are addressed by the appropriate personnel or professional. Some examples of needs and issues that must be referred include, but are not limited to, pain medication concerns, treatment of symptoms, provision of psychological counselling, diagnosis of medical conditions, and prescription of medication. Organisational reporting policies and procedures. Reporting lines differ between organisations. Reporting policies and procedures would typically include how to identify the limits of your role, to whom you should refer a concern or issue outside your role, steps in referring a concern or issue outside your role, steps in confirming that concern or issue outside your role was referred correctly. Communication in a manner that shows empathy and provides emotional support. Every person will react differently to the news of the diagnosis. Some people may respond with anger, others will respond with denial. Making decisions during this time can be difficult for everyone involved, especially if they have not yet accepted their circumstances. The client and relevant others will need understanding from you and everyone on the care team. The life-limiting illness has dramatically impacted their lives. They will need emotional support to get on their feet again. You must communicate with the client and relevant others in a manner that shows empathy and provides emotional support. Communication will revolve around the client's preferences for their quality of life choices. Giving the client and relevant others emotional support will help them make best choices for the client care. Making the best choices can improve the client's quality of life. Empathy is understanding and feeling the other's emotions. Empathetic communication involves active listening, where you must listen to both what is said and not being said. Listen without judgment and dedicate your full attention to the person. You can also use the following communication strategies. For the person, listen to what the person has to say rather than doing most of the talking. Carer, showing an understanding of the carer's thoughts by paraphrasing or repeating what they said in your own words. Family, asking follow-up questions to know more about their experiences, thoughts, and feelings. Others identified by the person, asking follow-up questions to know more about their experiences with the person and how they feel about the person's situation. The other ways you can show emotional support during communication include letting the client and relevant others know that you're always there to listen, encouraging the client and relevant others to ask questions or share their concerns about the client's preferences and quality of life choices. Regularly checking on the client and relevant others' emotional well-being. This can be as simple as asking them how they are doing during the conversations. In this part of the session, we have covered respecting the person's preferences for quality of life choices. In the next session, we will learn about following the person's advanced care directives in the individualised plan. From here, you need to go to your tutor's online learning portal and complete the assessment activities. Thank you for your time today, and I hope you found the session informative.